What morphological trait facilitates the differentiation of renal tubular epithelial cells from spherical forms of transitional epithelial cells? A. Size of the cell. B. Shape of the cell. C. Vacuoles. D. Nucleus orientation. A distribution on one side of the mean of 6 or more consecutive daily values that maintain a constant level is referred to as a distribution. A. Shift. B. Trend. C. Mean deviation curve. D. Normal distribution curve. The iris diaphragm will open up as the magnification. A. Decrease. B. Stay the same. C. Increase. D. None of the above. What two hormones are necessary to preserve calcium homeostasis? A. PTH and vitamin D. B. PTH and dehydroepiandrosterone. C. Parathyroid hormone and thyroid-stimulating hormone. D. TSH and vasopressin. For a qualitative VDRL test, inactivated serum is used in a quantity of A. 0.10 milliliters. B. 0.05 milliliters. C. 0.15 milliliters. D. 0.02 milliliters. Which of the following types of testing facilities must sign up for a proficiency testing program that has CLIA approval? A. Waived. B. Highly complex. C. Moderately complex. D. Both moderately and highly complex. Which of the following disorders is a symptom of hypernatremia? A. Vomiting. B. Severe burns. C. Renal failure. D. Potassium deficiency. Some automated blood cell counters' operating principle is based on the A. Amount of hemoglobin in the red cell. B. Value of the cell indices. C. Weight of the hemoglobin in the red cell. D. Size of the particle being counted. Fasting is crucial for accurate lipid results, as non-fasting patients may have falsely elevated lipids. Which of the following serum samples from non-fasting patients would be expected to have falsely elevated lipid results? A. HDL. B. LDL. C. Triglyceride. D. Cholesterol. Which reaction is the basis for the methodologies employed for the quantitation of bilirubin in serum plasma samples? A. Biuret. B. Diazo. C. Rouse. D. Jaffe. A1 or A2 patients are identified by blood type using A. Anti-A serum. B. Anti-AB serum. C. Dolichos biflorus serum. D. Anti-A2 serum. Fc portion activates complement pathway in immunoglobulin, unlike heavy, light, hinge regions. Which immunoglobulin molecule component is necessary for complement activation? A. Hinge regions. B. Light chains. C. Fab. D. FC. What corrective action may be necessary in order to issue a corrected laboratory report for an incorrectly reported culture ID and susceptibility? A. Filing a Quality Assurance Incident Report. B. Filing a Health Insurance Portability and Accountability Act of 1996 report. C. Filing an FDA medical device report. D. Notifying the patient. The majority of plasma thyroxine is A. Free. B. Bound to cholesterol. C. Bound to globulin. D. Bound to albumin. Which of the following measures could lessen the chance that a patient would contract an infection acquired in the hospital? A. Pre-surgical testing. B. Proper hand-washing procedure. C. Antibiotic therapy. D. Chemotherapy. Human chorionic gonadotropin testing is most frequently used to identify pregnancies, but it can also be used as a diagnostic marker for which conditions? A. Prostate cancer. B. Vaginal cancer. C. Testicular cancer. D. Penile cancer. Urine can be examined for the presence of to identify metabolic acidosis. A. Protein. B. Uric acid. C. Ketone bodies. D. Glucose. The temperature is 20 degrees Celsius. Convert it to Fahrenheit. A. 68 degrees Fahrenheit. B. 77 degrees Fahrenheit. C. 14 degrees Fahrenheit. D. 39.2 degrees Fahrenheit. What autoimmune disease has elevated titers of double-stranded DNA antibodies? A. Crest syndrome. B. SLE. C. Polymyositis. D. Scleroderma. The amount to which a procedure deviates from a calculated mean value or a known value is referred to as A. Percent deviation. B. Standard deviation. C. Coefficient variation. D. Quality control. In patients with acute pancreatitis, which two enzymes are elevated? A. Aspartate aminotransferase and acid phosphatase. B. Acid phosphatase and lipase. C. Aspartate aminotransferase and serum amylase. D. Serum amylase and lipase. It is said that pharmacokinetics is the study of A. What effect one drug has on the efficacy of another drug when taken together. B. What effect a drug has on the human body. C. What effect taking multiple drugs has on the human body. D. What effect the human body has on a drug. Which of these could be given to you as a prescription to treat or prevent deep vein thrombosis? A. Heparin. B. Vitamin K. C. Eliquis. D. Warfarin. The glomerulus role in the production of urine is A. Selective reabsorption. B. Reabsorption of water. C. Secretion. D. Simple filtration. Whose anti-human serum globulin is not used during procedures? A. D testing. B. Immunoglobulin testing. C. Autoagglutination tests. D. Reverse typing. What class of antibodies does a new infection produce first and is known as the default antibody? A. IgA. B. IgG. C. IgA. D. IgM. Which of the following organisms is referred to as a tiny, extremely pleomorphic, occasionally coccobacillary, gram-negative rod that is media enriched with X and V factors? A. Haemophilus influenza. B. Listeria monocytogenes. C. Escherichia coli. D. Bacillus anthracis. Dilute the serum sample to a 1:5 dilution. A. 1 ml of serum plus 6.0 ml of diluent. B. 1 ml of serum plus 4.0 ml of diluent. C. 5.0 ml of serum plus 1 ml of diluent. D. 1 ml of serum plus 5.0 ml of diluent. The hookworm's infectious stage is the A. Rhabdidiform larva with a long buccal cavity. B. Filariform larva with a notched tail. C. Rhabdidiform larva with a short buccal cavity. D. Filariform larva with a pointed tail. Which of the following describes an antigen, specifically? A. Foreign to animal. B. High order of specificity. C. Produced by action of antibody. D. High molecular weight. A screening test for RA is the RA latex test. A. Vulvovaginitis. B. Infectious mononucleosis. C. Thyroiditis. D. Rheumatoid arthritis. Fungi are frequently recognized based on their A. Solubility in 20% potassium hydroxide. B. Staining properties with polychrome dyes. C. Serologic and biochemical characteristics. D. Sporulation and the arrangement of spores on the hyphae. Beer's law states that the more light absorbed in the specimen, the darker the color produced, the more light absorbed, the A. Higher the concentration of the analyte. B. Longer the wavelength required. C. Lower the concentration of the analyte. D. More light transmitted. Acetoacetic acid, acetone, and other ketone bodies are among them. A. 3-hydroxybutyric acid. B. Lactic acid. C. Oxaloacetic acid. D. Acetic acid. Chancroid's etiologic factor is A. Haemophilus influenza. B. Haemophilus ducreyi. C. Haemophilus aegyptius. D. Bordetella pertussis. Centrifuging should be used for cell antibody mixtures used in tube testing to determine ABO group. A. 3 minutes at 3000. B. 15 to 30 seconds at 1000. C. 5 minutes at 5000. D. 2 minutes at 2000. A strict anaerobe is which of the following? A. Listeria monocytogenes. B. Nocardia asteroids. C. Bacillus anthracis. D. Clostridium botulinum. A grand stain uses safranine as A. Decolorizer. B. Primary stain. C. Secondary stain. D. Mordant. Which devices count the number of moles per kilogram of water rather than the concentrations of individual molecules, ions, and molecules in general? A. Osmometers. B. Immunochemical analyzers. C. Spectrophotometers. D. Blood gas analyzers. Red cells lacking G6PD will exhibit supravital staining, which will show the presence of A. Rubroblasts. B. Plasmodium species. C. Haineis bodies. D. Howell-Jolly bodies. The accepted and typical temperature and time for inactivating serum are A. 25 C for 1 hour. B. 37 C for 30 minutes. C. 56 C for 10 minutes. D. 56 C for 30 minutes. What is the normality of a sodium hydroxide solution with a molecular weight of 40 and 20 grams in 100 milliliters? A. 1.0 N. B. 5.0 N. C. 0.5 N. D. 0.4 N. The principal cation present in extracellular fluid is A. Bicarbonate. B. Chloride. C. Potassium. D. Sodium. Entamoeba histolytica trophozoites typically contain A. Eccentrically located endosome in the nucleus. B. A coarse, granular, blunt pseudopod. C. Bacteria and coarse granules in the cytoplasm. D. Red blood cells in T cytoplasm. Direct control of blood glucose levels is provided by the hormone A. Thyroxine. B. Hydrocortisone. C. Insulin. D. ACTH. Reagent reactivity in syphilis serologic tests may be caused by an acute or persistent infection such as A. Helicobacter pylori. B. Infectious hepatitis. C. Lupus erythematosus. D. Pneumonia. When positive in any way, the modified grease nitrite test is practically diagnostic of A. Significant bacteriuria organisms per milliliter of urine. B. Any bacteriuria to 10 organisms per milliliter of urine. C. Bilirubin in the urine. D. Phenylalanine in the urine. The direction of migration of each serum protein in an electrical field changes when using a buffer with a pH of 8.6. A. The positive pole. B. The negative pole. C. Both poles. D. Either pole. When test results fall within the ±2 SD range, the ratio of test results outside of that range will be 1 out of 2. A. 5. B. 20. C. 300. D. 3.